Hello everybody and welcome to the Tuesday edition of Video Clips. I have some announcements as usual, and the first is we're just a few weeks away from the start of the Diet and Lifestyle Intervention Program taught by Dr. John McDougall and Dr. Caldwell Assistant and me and Neil Barnard and all the usual suspects. 39 continuing education hours for doctors, nurses, and dietitians, but you don't have to be a health professional to take it. And a lot of people just take it because they want to learn from these incredible people. So if you're interested, send me an email. I'll send you a course catalog and some information, or call the office. And then last night we actually did our first psychiatric drug withdrawal class. The second one will be on May 21st. And sometimes I think I'm beyond getting angry again at stuff that goes on in the medical field, but I got to tell you, even just going through that information last night gave me a whole new feeling of anger about how awful what's going on really is. So I strongly recommend that you participate in these advanced study classes. They're really terrific. And then things that are going to get posted on the members' website, and you can watch them anytime. So last week Gary posted his gardening video, and then tomorrow actually will be posted the interview with Howard Jacobson, the co-author of Whole, Rethinking the Science of Nutrition and the Low-Carb Fraud. And then the following week will be a cooking class with Chef Del, and it's so cool we can use video now that we're doing it this way. So if you haven't logged on to the members site lately, you want to check this stuff out. It's actually really, really cool. Now, coming back to the subject of anger, I'll give you something to be angry about at the end of today's topic. We've talked about psychiatric drugs. It's kind of related to the advanced study issues. 6 million kids in this country are now labeled with ADHD, and most of them are being medicated for it. And according to a group of mental health professionals, there are a lot of undiagnosed children out there, and my gosh, we should be looking for them so we can drug them too. I'm not kidding, that's exactly what's going on. The reason is that these kids suffer from a little bit different version of ADHD. It's called sluggish cognitive tempo. The new condition is defined by symptoms like lethargy, daydreaming, and slow mental processing. In other words, vague symptoms that are in the eye of the beholder. And what all this really means, all these vague criteria that are used in the mental health business, means any one of us could be diagnosed with these silly conditions on a given day of the week. And lots of healthy people get turned into sick patients by being diagnosed with these conditions. Now, the claim is, some are saying that there are as many as 2 million children who are afflicted with this disease. Of course, more research is needed. That's the answer to everything in our country in the medical field. And Eli Lilly has a drug called Strattera that it believes can be used to treat the condition, and they're funding trials. I'm going to come back to that in a second here. There's a big article in the New York Times about this, and according to the Times article, 136 pages of the January issue of the Journal of Abnormal Psychology was devoted to this new condition. And one paper claims, according to the Times article, that, quote, the question of its existence seems to be laid to rest as of this issue. In other words, case closed. We know that children who daydream are sick and we need to medicate them. One of the leading proponents for childhood ADHD is Dr. Russell Barkley, and he claims that sluggish cognitive tempo has become the new attention disorder. It's almost hard to believe that these people expect to be taken seriously, and they are taken seriously. We're undoubtedly going to medicate another 2 million kids. Now, why is this going on? Why is there such a push all of a sudden to come up with a new type of ADHD? Well, an increasing number of people are starting to question whether or not there really is any such thing as ADHD, and to the extent that some kids may have some trouble focusing, they're thinking maybe it isn't such a great idea to drug these kids. Dr. Peter Breggin, who is the author of over 20 books on the inappropriate prescribing of psychiatric drugs, including the ones that are used for ADHD, says that there is no such thing as ADHD. He said, and he not only says this in his books, but when he appeared at one of our conferences, that in over 40 years of practice, he has never seen a child that has ADHD, nor has he ever medicated a child or medicated anybody for that matter in his practice. Well, I think a lot of people are starting to agree with Breggin. There's a growing awareness that what we have created is awful, and the side effects of these drugs are awful. I'll say a little bit more about that later. And so now it's time to start a new industry, and the new industry is going to be called sluggish cognitive tempo. Now, there are a few voices of reason who are speaking out. I'm one of them. Another one is Dr. Alan Francis at Duke University, who says we're seeing a fad in evolution. Just as ADHD has been the diagnosis du jour for 15 years or so, this is the beginning of another. This is a public health experiment on millions of kids. Well, the diagnosis du jour has resulted in millions of children being medicated, most, if not all, unnecessarily so, with absolutely no benefit. You can check this out because everybody can read these studies on the internet now. It isn't just limited to a select group of people. There isn't a single study that's ever shown a long-term benefit from taking these drugs. Now, according to the New York Times article, sluggish cognitive tempo has been researched since the 1980s, but has never been formally recognized as a disease in the Statistical Manual of Mental Disorders. Now, this is truly amazing because the DSM is not a scientific book. It's a group of self-appointed experts who get together and basically make subjective decisions about what is and is not a disease. At one point in time, homosexuality was considered a disease. And of course, grief and sadness and excessive shopping are labeled diseases. So if the evidence isn't strong enough to make SCT or sluggish cognitive tempo a disease, my gosh, it must really be weak. Now, the argument for acknowledging SCT as a disease is that there are lots of children who are diagnosed with ADHD who aren't hyperactive but just don't pay attention well, and those kids would be better off with a different diagnosis. I have an idea. How about no diagnosis for kids? We teach them how to focus and pay attention and do well in school and at home. Well, the current consensus is that the mental health profession is still working on this. According to experts, the symptoms aren't even well defined yet. The reality is that as this gains more and more attention, there's nothing to stop doctors from labeling children with this condition, and schools and teachers and that sort of thing, and medicating kids for it. Now, I mentioned before, Eli Lilly, ever the helpful company, is funding clinical trials to see if SCT improves with their drug Strattera. And they reported in the Journal of Child and Adolescent Psychology that the drug indeed resulted in improvement. An email from an Eli Lilly spokesperson stated that, and how they write this stuff with a straight face goes beyond me, stated that sluggish cognitive tempo is one of many conditions that Lilly scientists continue to study to help satisfy unmet medical needs around the world. Well, the definition of unmet medical needs, according to Lilly, I think, is that made-up diseases for which their drugs can be prescribed. In fact, the doctor who conducted the clinical trial is paid by Lilly, and he got $118,000 between 2009 and 2012 for consulting and speaking engagements. He said that Strattera's performance with SCT is, quote, an exciting development. I'll bet he is really excited, because one way to keep the money coming from Lilly is to show usefulness for their drugs. Now, what Lilly and the good doctor failed to disclose is the side effects of Strattera, which include, now listen to this, psychotic or manic symptoms, hallucinations, delusional thinking, mania, hostility, and aggression. And we are supposed to give a drug that causes these things to kids who are daydreaming? Are you kidding me? I mean, I was asked during the advanced study class last night when we were talking about psychiatric drugs, you know, what do we have to do to end this? Well, I think we just have to tell the others. I mean, we're not going to clean this up with the FDA and the drug companies and people who are ethically challenged to actually participate in this ridiculous. We're not going to get them to stop. It's too lucrative. They're not going to stop. So I expect you to help me by telling others. Forward this video clip to people who you think should watch it. We have got to start helping people understand the reality of what's wrong in medicine. This is one part of it right here. And I can't think of anything more egregious and horrible than drugging innocent children. My gosh, if these drugs were around when I was a kid, I'd have probably been drugged. I do think I spent my share of time in class daydreaming, actually. So anyway, that's all for now. As usual, do pass this on to others. Thank you for watching. I'll be back to you on Thursday, and have a great day.